Can you see me?
Yes.
Yes, hi. Hi, I'm Waldo Engelbrecht.
Hi.
We chatted briefly a while back.
Yeah. Yeah.
Yes. Yeah, so I think if I can maybe could just give you a rundown what we want to talk about and what you're comfortable with and so on. And then, let's see how it rolls.
Okay. Yeah. I mean, I'll talk about whatever you want to talk about. I'm pretty open.
Okay.
I think that it would be helpful for young dentists to hear about like hardships and mental breakdowns and things
Yes.
that I think
Yes.
many of us have gone through.
Yes. Okay,
Yeah.
cool. Okay, we're definitely on the same page there, that's for
Okay.
sure. Yeah. So I think I usually just introduce, just saying welcome, and then I'll just say, well, this is Carl, and I'll just ask you to really tell people who you are. I don't really
Okay.
want to have a massive CV that I want you to tell people. I want you to tell people who you are. And then maybe I'll just maybe have a backstory in a sense of how I got in touch with you
Sure.
via Mark Bowers.
Yeah.
I think this thing's a little bit loud. Okay, that's a little bit better. Okay. And then, just tell us how you grew up,
Okay.
and then how you got into dentistry, and then a little bit, just to give a little bit of context, like your mentors that was really
Sure.
important
Hmm.
for you, your residency in Brazil
Yeah.
with the implants, and then where that turning point came for you, where stress and these hardships
Okay.
changed your view about dentistry and what's necessary for us,
Okay.
how to handle it. And I think, and yeah, I mean, and you can talk about your AI ventures and all that your other stuff. And I'd also like to maybe just hear from you. I think in one of the other, what was it? In I think it was with Coachman that you spoke to. You said something about having a community of dentists or a platform for these guys that have hardships
All right.
to share this with each other. Has there been something that has come to light that
There
has?
was there was someone that was trying to do this, and I don't think it ever really caught on. He had wanted me to help him do it, but I don't think he ever finished it. So, yeah, I mean, I still think it's something that's needed. I
Yeah.
just um, I wish I had more time because I would like to do that,
Yeah.
you know.
Yeah, well, and I think that's the other thing that we need to talk about is time management,
Yeah,
uh, uh, daily habits. What do you do
yeah.
when you have adversity that comes your way? How do you handle stress now? Do you have like a debrief after big cases? How do you fill your tank?
Yeah.
Uh,
Yeah,
uh,
these are all great topics.
to get healthy again. So,
Yeah.
all right.
All right.
Okay, let's get it started. Well,
Okay.
uh, let me just get this thing on again.
So will you be recording video as well?
I'm recording video now. I don't.
Maybe put it on YouTube or something.
Yes.
Cool. Okay.
Yeah. Okay. Well, welcome to More Than Dentistry. I have the privilege to have Dr. Carl Stanley with me today. Carl, welcome.
Thank you. Thanks for having me. Nice to talk to
Well,
you.
yeah, great. Well, Carl, if we can just sketch a picture. I did a talk about silence, stress, and self-sabotage a
Yeah.
while back at a Battle of the Speakers conference, and just after the talk, Mark Bowers came up to me and said, listen, there's someone that you need to get onto the podcast. Have you heard about Carl? And I said, no, I don't know Carl. He said, look him up, and then maybe you guys need to get in touch. And from there, I researched, I looked at what you're doing, and I was really excited to maybe getting the opportunity to have a talk with you. So thank you for being here. And then I think let's just start off. Who is Carl Stanley?
Yeah, well, first, I'm glad that Mark introduced us. He's a great guy, very talented clinician, really leading that area of the world, I think, in South Africa. So yeah, it's nice to get in touch. So I am, of course, a dentist. I am a father, which is kind of my number one job, I think. I'm a speaker, and now I've kind of turned into an entrepreneur as well, and we can talk about that later. I think that this first topic, just like who are you, is something that I've tried to rethink, because I've tried to, ever since I went to dental school, I just associated myself as a dentist. And I think there's a problem with that, because in dentistry, we have failures, as we all do. We have patients that don't want to pay. We have patients that have pain. We have implants fail, or crowns crack, or whatever it is. And then when we think about ourselves, like, who am I? I'm a dentist. And then something fails, it brings our whole self-esteem down. And so now I try to think of I answered your question wrong. I should have said first, I'm a father who happens to be a dentist. Yes. And I think that that makes a big difference in your life. Because when I only associate myself with dentistry, with my profession, then when I have something bad happen in my profession, it really brings me down.
Yeah, because we spend so much time in our work.
Yeah.
And then we take all the negative stuff back home, which is
right. Yeah, oftentimes we don't focus on, hey, I just did that great restoration, or that implant was perfect or something, but that negative is hard.
Yeah. So tell us, where did you study? How did you get into dentistry?
Sure. Yeah, so I was an artist my whole life. Growing up, I was a professional dancer. I wanted to be a cartoonist. I loved physical art, performance art. I was a musician, a professional musician. And in college, I really started liking science. I was a biology major. I really started liking science and thought, hey, maybe I'll be some kind of a doctor. And I wanted to do plastic surgery. And then I knew I wanted to do some type of surgery. So I talked to my dad, and my dad said, hey, why don't you go? My dad's a dentist, and my brother's a dentist. Okay. And my dad said, why don't you go hang out at my friend Chris Larson's office? He's an oral surgeon. So I did, hung out there, really fell in love with oral surgery. I loved everything about it, and said, okay, I'm going to be an oral surgeon. And then I went to the University of Southern California for dental school, thinking I'm going to be an oral surgeon. And then I met Pascal Magne, who was my first mentor. And he made me think, okay, I think I want to do aesthetics also. So now I have to do aesthetics and surgery. So I did a really long kind of internship with Pascal, almost like a mini-residency for 18 months. And at the end of that, I told Pascal that I wanted to learn implants. And so he said, okay, you have to move to Brazil, and you have to learn Portuguese. And I said, okay. Sure. He said, Dr. Brandemark is teaching in Brazil. There's a lot of really great research and implants coming out of Brazil, and they're really leading right now. So if you want to learn from the best, you should move down there. So I did. I moved to Brazil. I did my implant residency, implant specialty in Brazil, which was an amazing experience. And so in Brazil, they actually have an implant specialty. Do they have that in South Africa?
No, no.
No, okay, so there actually is an implant specialty there. You can be an implant specialist, which is kind of cool. So I came back. I was teaching at the clinic with Pascal again. And then he introduced me to Sasha Jovanovic, who, of course, is, one of the most famous periodontists in the world, one of the guys who kind of started bone regeneration years and years and decades ago. And so I worked really closely with Sasha. And so I was doing this perio-pros kind of practice. And it was about 5 years ago that I met my third mentor, who is Christian Coachman, that everybody knows, the most Googled dentist in the world. And Christian really elevated my digital game. So I've had those three mentors. Like Pascal is like my aesthetic mentor, Sasha is my surgical implant mentor, Christian is like my digital mentor. And through these three amazing guys, I've just tried to follow anything that they're doing. And that has turned into who I am today, I guess.
Sure. Well, obviously, you must be a very high performer. I've seen you've published a number of articles, but that also comes with a lot of stress, a lot of pressure. How do you, and that's really something that we need to talk about today, is stress, anxiety, burnout. And this is a topic that you're very passionate about. Can you elaborate for us?
Yeah, so like you were saying, I was performing, I felt like at the top of my game. I was treating high-profile patients. I had a successful practice. I was lecturing all over the world. I was, lecturing at American Academy of Cosmetic Dentistry and Academy of Osseointegration, really like these high-level academies and conferences. And then I kind of had a mental breakdown. And it was mostly because of the clinical aspects of dentistry and balancing that with family life, I think. I would have difficult situations in my practice, whether it was a difficult case or a patient wasn't happy or they didn't like the aesthetics or an implant failed or patient had a sinus infection after a sinus lift. And I would take those problems home and it would get in the way of my relationship with my wife or my relationship with my son or with my parents or with my friends. And I remember times, this one patient specifically, where I would be like sitting in my bed at night, just looking at the ceiling, thinking about this patient and, if he or she was going to sue me and if I was going to lose my license or if I was going to be embarrassed in front of my colleagues. And these things just drove me crazy. And so I called my dad, I called my brother, both were dentists. And I said, I'm like 8 or 9 out of 10 stressed out almost every day. And are you? And my dad said, well, not now, but I definitely was for many years. And my brother said the same thing. He said, I'm not as stressed out as you, but I definitely am. And so I actually considered quitting dentistry. I remember having this conversation.
Can I just interrupt you quickly?
Sure.
Can you pinpoint to that exact moment where you felt you are having a mental breakdown? What was that specific? Did you have a specific incident where you say, this is my rock bottom?
Yeah, I think it was this one patient where it was basically a very, very large case. The patient, I did the case, the patient asked for a significant amount of money back. We gave the money back. I was worried that she was going to sue me, even though I did nothing wrong. And I think that is a big problem, at least in the American society. I don't know how it is around the world, but you can get sued by a patient whether you do anything wrong or not.
Yeah.
And even if you win, it still costs you $100,000 or something. So that, I think that was the low point for me, was worried about litigation and having it interfere with my family life. Because I just had a new son. I had a newborn baby, and I was kind of realizing what was important in life.
Yeah. Well, you, in a sense, you were lucky enough to know that you could talk to your father and your brother just to feel it out. Because there's a lot of guys out there that are in private practice that they don't have anyone to talk to, just to ask, listen, are you stressed?
Yeah, well, I think this is the problem. I think this is the problem, is that in dentistry, so many of us work by ourselves in a silo, sometimes windowless rooms for decades at a time, without other dental interactions.
Mm.
And what I realized is that only dentists understood me. When I would go and I would talk to my friends who are successful or not, or stressed or not, when I tell them, hey, I'm so stressed out, I'm thinking about quitting dentistry or modifying what I'm doing, they would say, Kyle, what do you mean? You have a nice house, you have a beautiful family, you're successful, you're well respected in your community, you're a doctor. What do you have to be stressed out about? And what I realized was that there's very little sympathy for successful people in our world. And I was a hypocrite like this. I was a person who would see a celebrity having, let's say, a mental breakdown and say, how can Justin Bieber be, freaking out when he's worth $300 million? And then what I realized was that mental illness or mental stress doesn't care how many dollar signs you have, or how many zeros you have after your name, or how many accolades you have, or how nice your home is, or how good your family is, or if you have a PhD or a doctorate. It happens to everybody. And for me, I needed to talk to dentists about this. Even talking with my wife. When I talked with my wife about it, she said, well, every profession is stressful. If you change your profession, it's going to be stressful too. And I was like, you don't get it, And she's very empathetic, but she just didn't get it because she hasn't been through what we go through every day. So you're right that I was lucky to have my brother and my dad, who I felt like I could be open with and tell them these problems. Now, since I've, of course, talked to other dentists about it, and I think they appreciate having someone to talk to.
Yeah. Well, at that point where you said, maybe I should quit dentistry, what changed for you? How did you diverge your path to get back into having a healthy practice?
Yeah.
What's the things that you put in place to say, listen, I can go on with this?
Well, I think I had to break down my ego, which was the first thing. I had never failed at anything. And I think many of us dentists are like that. We're high-performing people. You have to do good in high school to get into college. You have to do good in college to get into dental school. You have to do well in dental school if you want to specialize. Like, we're always performing at very high levels. And, in general, we're somewhat intelligent, or at least hardworking. And then we finally get to a point in our life where we fail. And oftentimes you don't see those failures until you're about, 5 years, 10 years out, you start seeing these. And so for me, it was very difficult to fail. I grew up in a family of 4 boys where, we're always playing sports. We were all very good at sports, and we didn't fail a lot, to be honest with you. So getting my ego to where I could start taking criticism was very important. Understanding that no matter how good you are, you're going to fail. One of my mentors, Sasha, has a very good quote that he once told me. He said, "I've failed more than you've tried." And I love that. That was like really powerful for me, especially because I think of him as never failing and always having amazing cases. So that was a big thing, is bringing my ego down and understanding that it's okay to fail and you can learn from it.
Okay, cool.
I then kind of, to answer the other part of your question.
Yeah.
So that was like the emotional change that I had to make. And then the physical or scheduling change for me was limiting my days of clinical practice. So at the time I was working, 4, 5, 6 days clinical practice, plus lecturing and research and family and all this stuff. And it was just too much. And so I started decreasing a day. And I realized that, I had severe back pain at that time too. Once I started decreasing my days, my back pain went away. I was much happier. I made less money, but was happier, which was really great. And I realized that money isn't what makes me happy. It was time with my family and freedom and less stress. So I had to, it was difficult because I have partners and I have, patients that depend on me, and I had a lecturing business. And so I had to move around a lot of different pieces. And I also had to say no too, which was something that I really never did. I said yes to every opportunity, which I think is good when you're a young professional, is to like say yes and, get as many opportunities as you can. But I had gotten to a point in my career where I needed to say no, whether that was to patients or to lectures or whatever.
Yeah. That's great. What do you do now? Just when you wake up in the morning, how do you start your day? Do you have a morning ritual or ways you go about doing your daily things, and then your week? How do you plan your week to manage your stress?
Good question. So I'm going to tell you how I used to do it before my, let's say, mental breakdown, and how I do it now. So what I used to do is wake up, grab my phone, start going through my emails, look at the schedule for the day at my office, kind of start thinking about where I need to be, make sure I have all my components. Do we have stuff back from the lab? Immediately. And I would leave very early. So I would leave, around, let me think, probably around 6:45, 7 a.m., because we usually start around 8. Now, what I do is wake up, look at what time it is, basically. And then I'm usually woken up by my son crying in the morning. I get him, and him and I eat breakfast. We play with toys, and sometimes we go outside for about 2 hours. So I spend about 2 hours, 2.5 hours in the morning with my son, which of course brings your ego down, because you're cleaning snot off of his nose and making breakfast and cleaning up spills and very mundane things that doesn't allow you to have an ego. It also kind of grounds me, and sometimes literally grounds me, where I'm down on the ground, playing trucks or building blocks with him. And I try not to really think about my work day too much. Then I starting later, so I have later start times now. And that has really allowed me to ground myself in the morning, come in, not feel rushed, and be ready to start the day, and give myself now to my profession, whether that is lecturing or whether that is at my office with patients or at my AI business. It really allows me to be present there.
Your practice is in Hollywood.
Yeah, in like West Hollywood, Beverly Hills area.
Yeah. And then let's say you have a very difficult patient or a difficult case for that matter.
Yeah.
Do you have like a debriefing process afterwards where you say, listen, because one of my things that I have is like, today I had one patient. I worked from 9 to 5 on one patient, did implant crowns, temp crowns, did everything, and I was exhausted. And
Yeah.
but now, if I don't debrief myself afterwards, I'll go, I can't sleep, because if it went well or if it went terrible,
Yeah.
in both instances, I can't switch off. So, do you have something to switch off afterwards? A
Yeah.
healthy way of switching off?
For me, it's my photos. So I usually don't do a debrief directly after, because oftentimes I'm trying to get home to make dinner with my family and have my time with my son before he goes to bed. When I come home now, I come in, say hi to my family, and I try to leave my phone right when I walk in, and I try not to touch it until my son goes to bed. Because again, I have limited time with him. I have my 2 hours in the morning, and then I usually have about an hour and a half with him before he goes to bed after I get home. So my de-stressor now is when we make dinner together as a family. We try to do that about 3 nights a week. So we make dinner, we're cutting vegetables, which is kind of, what's the word? It's almost like a meditation,
It is.
cutting vegetables, cooking. And again, it's a point that allows me to not have an ego too. And then really to debrief my cases, whether it's later that day or the next week or when I'm setting up slides for a lecture, it's going through the photos. I think photos is really important for any dentist, but especially young dentists getting out of school. Pascal always called it his third eye, and I totally agree with that.
Yeah.
That I sometimes see things on the photos that I didn't see in person, even if I was there, like you said, from 8 to 5 working on them.
Yeah.
I see it after and say, oh, that's why I couldn't get the crown down, or that's why the implant wasn't going in well, or whatever. And I have learned so much from my photos. Looking back, sometimes I'll just go through. I'll look through our schedule at old patients, because you can search by procedure. So I'll look by procedure and say, oh yeah, what was that case like? Go back, look at the photos. We take a lot of pictures. So look at everything, and I really learn a lot that way.
Cool. You also spoke quite a bit about burnout, suicide. Do you have a lot of stats around that, and how that influences our profession?
Yeah, so our profession is one of the highest suicide rates in any profession. When I look at the research, it kind of goes back and forth. It's between like 1 and 5, let's say, which is very, very high. We are over 500%. One research study shows, I think it's 526% more likely to commit suicide than a non-dentist, which is very scary. Most dentists that I know of another dentist who's committed suicide, which is staggering, and you wouldn't find that with other professions. So oftentimes when I'm speaking about this topic, I'll say, raise your hand if you know someone who's committed suicide that's a dentist. And like 75% of the room raises their hand, which is so sad. And there are a bunch of different topics that I think contribute to this. And we've talked about some of them, which is like lack of sympathy. We measure in tenths of a millimeter, which is like crazy, right? We wear 8.0 loops, microscopes, and we're measuring very, very small amounts. We're working in a very dynamic region of the body. That's very difficult. I mean, I have a good friend who's a foot and ankle surgeon, and him and I talk about surgery a lot. And his patients, when he comes into the room, the patients are sedated by anesthesiologist. There's a tourniquet around their leg. It's fully sterile. He's standing up straight, which is so different from what we do. Our patients have tongues and cheeks, and they have to breathe and kiss and chew. We can't tell them, don't move your mouth for 6 weeks or 6 months or a week. It's non-sterile. We're hunched over. We're working through a Cheerio. It's a difficult profession. And I shouldn't say it makes sense why people commit suicide, but you can see how there's so much stress. And of course, suicide should never be the answer. But you can see why there's so much hardship in our profession. It's a scary thought. And I think one of the things, at least in the United States, that contributes to it as well are student loans. I went to probably one of the most expensive schools in the world. I graduated with over $400,000 in debt. And that was just from dental school. I was lucky to have my college paid for by my parents. So you get out and, oftentimes we buy a house and, there's more loans, and buy a car and there's more loans. You buy a practice and there's more loans. And pretty soon you get to this point where you can be $2 million in debt, which is this like giant cloud over your head every day. And this is what forces doctors, I think, to sometimes not do the right treatments, to try to, talk patients into doing treatments because they need the money, which is very sad. This is why many doctors are committing suicide, because they feel like they'll never get out of this problem. And I think before we even go on, I should say, if anybody is stressed and needs somebody to talk to, message me on Instagram. No problem. I'd be happy to talk to you.
Yeah. Let's talk a little bit about the image of dentistry and what that. What that also influences how we feel about it and how that stresses you out even a little bit more.
Yeah, this is one of my 12 topics, is that we have a very bad rap in media. Dentists are always perceived as being these bumbling idiots that are trying to rip people off, that are, masochists, that like to hurt people. And that doesn't do anything for our profession. It forces patients to be more afraid when they come in. This environment of working in fear is very stressful for us. They tested dentists when they gave injections, and our blood pressure goes up like 20 points sometimes because we don't want to hurt anybody. And sometimes pain is part of the situation. We try to minimize it as much as possible, but you have to do certain things to get to the ultimate goal. So I would love to have positive media associations with our profession. I think it's been 20 years since there's been positive media around dentistry. And the last time was maybe when they had shows like The Swan or Extreme Makeover, where they changed people's smiles and really showed how it impacted their life. So it would be nice to have that. Every time we have media about our profession, it's about a problem. It's about how a dentist was committing fraud. It's about how a dentist had a patient die in the chair, or that's a horrible thing, of course. But it would also be nice if mainstream news showed how changing your smile can help you get a better job. Changing your smile can help you start dating again. Changing your smile can bring your confidence back and allow you to have positive associations with eating or with your family. So that would be nice, and I think that would help many people. It would help people get better dentistry. It would help doctors so that their patients weren't as fearful when they were in their practice. That's been, a dream of mine, and it's one thing that I'm trying to work with the American Dental Association.
Okay. So are you guys doing advertising, or how are you getting your message over to the general population?
Yeah, well, that's what I'm trying to work on right now, would be having these associations use their dollars to do general campaigns for our profession. Just like, the milk industry does campaigns for their general profession.
Yeah, I think my story is a little bit, well, probably, I think we all basically have the same sort of problems. My problem was I was probably also burnt out, but I had a habit of drinking too much.
Mm-hmm.
And that's something that also no one wants to talk about, is because of the stress, anxiety, and so on. Everybody's leaning on some sort of a crutch that's also not helpful for the patients and for yourself.
Yeah, I think I remember seeing a statistic, I don't remember the numbers, but it was much higher that dentists have substance abuse problems, whatever that is, whether it's gambling or drinking or drugs or sex or something. There's an output where that stress goes to, and I think it's because oftentimes, like you said, we feel like we can't go home and talk to somebody about it, whether it's our spouses or our friends or our colleagues. For me, I was worried about appearing weak, because before I went through this, that's what I thought about people. I said, if someone's depressed, they must be weak. They can't take the stress. But it's because I just hadn't been stressed yet. And once I went through that, I was like, whoa, I could really empathize with people that have gone through this. And when I started talking about this on Instagram, which was almost a year ago, I think, I had so many messages. I mean, I would 10, 20 messages a day from when I was doing those posts saying, thank you so much. I thought I was the only person that had it. And they said, it's so nice to know that I'm not the only one. And I had some people ask me if I would even do like therapy sessions where we get, 5-10 dentists together on a Skype call and we talk about our stresses, because I feel like no one understands being in the trenches of dentistry unless they've been there, unless they've, had these failures, they've owned practices, or they've worked at practices, or they've, dealt with staffing and home, family, work management and balance. It's a hard thing. And I'm not 100%. I still have a lot of things that I could change.
Yeah, we all can. So,
yeah.
What do you think is the way forward for us as a profession when we get to these topics? What are we going to do as the dental fraternity to say, listen, it's all right to be first place vulnerable enough to share these experiences with each other, having the courage to do that, and then so that people can see we are still human, and we can accept each other's with all the faults and flaws. That's part of who we are.
Yeah, well, I think you said it a little bit, but it's more of a general thing outside of our profession, is making mental illness not as taboo to talk about. Mm-hmm. Now, of course, it'd be nice to have that specifically in our profession. I have been oftentimes campaigning for large associations and conferences to have people talk about things other than how to do a better crown, how to do a better implant, how to do a better veneer, and have a session that talks about mental health, have a session that talks about, work-life balance. We get to a point where it's like, yeah, okay, you can make a better crown, but it doesn't matter if we still have this high suicide rate. Who cares? Mm-hmm. And so I'm happy that I've started to get invitations, because I've kind of become a little bit known for this topic now, because not very many people are talking about it, to where like I'm speaking at the Academy of Osseointegration this year in Seattle about this topic, which is really nice to have the podium of a well-respected conference to talk about this topic. And as nice as that is to have these invitations, what's also happening in the background is when I get invited to speak and people ask for my topics and I give them these topics, oftentimes they say, nah, we'd really just like you to talk about implants or smile design. So it's getting there. I am getting more invitations. I am seeing other dentists talk about this. My friend Simon Chard from the UK, him and I have been trying to campaign about this as well. And some of my other friends, I've seen other dentists on Instagram and Facebook also sharing their stories, which I think is great. So for me, I think the two answers would be making the topic not as taboo, understanding that most of us have gone through this, or if you haven't yet, you probably will. So talk about it and talk about it early. And then the second thing is getting it into our education process, our continuing education process. Having speakers talk about this, having roundtable sessions, maybe having group chats where we can express ourselves. I always tell this story, but I'll get invited to speak a whole day, 8 to 5, and it'll be about implants and smile design and zero bone loss concepts, that. And then for 45 minutes, usually after lunch, I talk about this topic. And afterwards, people come up to me and are crying, giving me hugs, saying thank you. It's like, I just talked for 8 hours about implants and smile design. And the 45 minutes that I talked about this topic is what they thank me for. And I think that's really powerful.
Yeah, that's awesome. Wow. Yeah, well, I hope we can get you out to South Africa at some stage if you're up for it.
It's the number one place on my list to go is South Africa. So, yeah, I would love to come.
I'll chat to Mark to see if we can get something going. Yeah. Let's maybe go on to the other things that your entrepreneur endeavors, the AI stuff. Can you? Because that's really exciting stuff.
So there's a little bit of a connection too to what we've been talking about, and so I started a company with two co-founders named Pearl, and we raised $11 million. We're venture backed, and we are really a company that focuses on computer vision in dentistry. So that is allowing computers to see like a human. Mm-hmm. And a lot of what we're doing is because of this stress that I went through and trying to limit liability for doctors. Whether it is liability when you're reading x-rays, liability when you're doing an intraoral scan or making a crown, liability on the insurance side, liability when buying a practice or evaluating a practice. So we have a few different products, but everything involves imaging in dentistry. So it's reading dental x-rays with the eyes of an expert. It is looking at intraoral scans with the eyes of an expert. So we do things like you take an x-ray or even a full set of x-rays. Let's say you take a FMX. We can find all of the different tooth numbers, the existing restorations, caries, bone loss, widened periodontal ligaments. Most of the things that you or I would see in an x-ray, we can have annotated right there. And with AI, what's great about AI is it doesn't get tired, it doesn't get stressed, it doesn't have bad days like we all do as humans.
Yeah.
So it's like, we call it second opinion. It's like someone looking over your shoulder and saying, hey, did you see that caries, or did you see that, periapical lesion? Because unfortunately, if we miss something, we can be liable for that. And it can come back to haunt us later, even. And that's happened to most of us.
Yeah.
On the dental insurance side, we're doing something really cool, which is immediate decisions with insurance carriers. So you're sitting in the chair and you can upload your radiograph, and the doctor and the insurance company agree that this is your ground truth, and you can have approval or denial right then, instead of waiting weeks and trying to find this out. On the lab side, we are analyzing intraoral scans and figuring out when it's good or bad, finding the margin automatically. And so with this, what you can do is take an intraoral scan, upload it to the Pearl software, and we'll tell you yes or no, basically. Is this good enough, or did you miss the contact, or do you have gingiva touching the margin? Maybe you should retake it. So to try to limit the bad data that goes to our laboratory technicians at the prep tooth level when we're there and the patient's numb and that. So those are some of the things that we're working on. It is a really exciting time with AI in general, not even in dentistry. The more I've learned about AI in the last few years, the more I think it will be in every aspect of our lives. So, so we're excited about it.
That's fantastic. Well, is there anything else is there a question that you would like me to ask you? Is there something else that you want to talk about?
No, I think we talked about, the important issue, which is talking to your colleagues, realizing that you're not perfect, and that it's okay to have stress, and we have to figure out how we can deal with it so that we can be a better dentist, be a better person in general that will allow you to be a better dentist. And just, I think, I thank you for having this conversation and, allowing this type of conversation on your podcast, because this is what's going to help people, is hearing, people like you saying that you're vulnerable, and people like me showing that I was vulnerable and am still vulnerable, because we all are. And so many times you see speakers or people on podcasts or, dentists that they only show their good cases. They always talk about how good they are. And we're human, we make mistakes. We have bad days. We do things wrong. We mess up.
Yeah, for sure. Well, thank you very, very much for your time and for the chat. And
it was a real pleasure.
And I hope we can chat again at some stage.
Yeah, I hope to meet you in person sometime.
Okay, cool. Thanks a lot, Carl.
All right, well, thanks so much.
Okay, bye-bye.
See you later.